There is nothing more heartbreaking than the loss of a child, and for many families across regional New South Wales, the words, "Your child has cancer," change life forever. Each year in Australia, more than 1,000 children and adolescents are diagnosed with cancer. It remains the leading cause of disease-related death in children. And while medical research has lifted survival rates to over 80%, around 200 children still die from cancer in Australia every year. Thousands more suffer severe and lifelong side effects from treatment: infertility, chronic pain, developmental delay, cardiac toxicity, and secondary cancers. The Children's Cancer Institute is doing something about it. Based here in New South Wales, CCI is the nation's only independent medical research centre wholly dedicated to childhood cancer. Through precision medicine programs like Zero and cutting-edge projects like Anya's Wish, they're giving hope where once there was none. Anya from Armidale was just 19 years old when she passed away from osteosarcoma, an aggressive bone cancer. Named in her memory, Anya's Wish is a world-leading research initiative focused on finding safer, more effective treatment for this brutal disease. Treatments that target the cancer, not the child, because we can and we must do better. Closer to where I live, I want to share the story of Peter, a bright, athletic 9-year-old. Peter loved running, gymnastics and horses. She was determined, sweet, and had already decided she wanted to be a vet when she grew up. But in the space of 2 weeks, everything changed. After a whirlwind of symptoms, multiple hospital visits, and finally an MRI, Peter was diagnosed with a tumour in her brain. She underwent surgery, then endured rounds of chemotherapy and radiations. Her doctors were hopeful. She ran each day, determined to get back to the things she loved, and for a while it looked like she had beaten the odds. But 6 months later, the cancer returned, this time in her spine. Surgery wasn't an option. Even so, Peter and her devoted family fought on, enrolling in a clinical trial and caring for her with love, hope and dignity. Peter passed away in 2022, but her courage and generosity live on. Her family published Tully's Sausage Sensation, a children's book Peter started while in treatment, with proceeds going to the Children's Cancer Institute. It's a beautiful tribute to a beautiful soul, and a reminder that every child lost is not just a loss to their family, but to the whole world. As her mother Kate said, we must not count just the cases, but the life years lost. I want to honour every family that has walked this road, often quietly and without fanfare, across our regional communities. The Zero Childhood Cancer Program, co-led by the CCI and the Kids Cancer Centre at Sydney's Children's Hospital, is now available to every child in Australia with cancer, no matter the type, stage or risk. Already more than 2,000 children have been enrolled, including many from regional New South Wales. But more must be done. Rare childhood cancers like osteosarcoma still carry devastating survival rates. 2/3 of survivors face lifelong consequences, and families in the region still face long travel, limited access, and fewer supports. Childhood cancer may be rare, but its impact is vast. With greater awareness, investment, and care, we can change the future for children like Peter and Anya. I knew both Peter and Anya's parents, and I've seen firsthand the courage, generosity, and grace. And yet, despite their loss, Anya's parents continued to lead efforts in research and fundraising to help other families and give future children a fighting chance. Their strength reminds us why this work matters. Let's honour it by standing beside them and backing the research, care and compassion that every child deserves.